calling to order the Committee on Health and Homelessness for our agenda today. Today is Thursday, March 23rd, 10:40 a.m. agenda here in conference room 329. Thank you, members. We're here to take up one bill and a number of resolutions. So we'll just start with SB 1044 HD1. First up, we have Department of Education.
Thank you. Good morning, Chair and Vice Chair and members of the committee. I'm Yvonne Humble from the Office of Student Support Services, testifying on behalf of the Department of Education. The department stands on its written testimony in support of this measure. Thank you for the opportunity to testify today.
Thank you. Next, we have the Hawaii Association of School Psychologists providing comments, Opportunity Youth Action Hawaii in support, and an individual cards printer in support. That's all of the testimony we've received on the measure. Anybody else in the room wishing to provide testimony? Any members on Zoom? If not, committee members, any questions?
One question.
Chair Bellotti.
Thank you. I think this is a very important effort. Is there any opposition to saying that this be a licensed behavioral health specialist?
I'm going to bring up my education officer.
And as you're doing that, I think the reason is understanding that this licensed person in the department may actually then be able to collaborate and work and oversee other folks that may actually help you in, the ongoing quest for Medicaid reimbursement.
No opposition. Good morning, Chair and Vice Chair. No opposition to that. Currently, the behavioral health specialist position, how the PD is written, doesn't require a license, but of course, we're always seeking to fill those positions with licensed personnel.
Okay, wonderful. And I think, it would give you, so my understanding is that by saying this, it could also give you a licensed psychologist, a licensed social worker, so there could be a broad range of folks that you could look towards.
Yes.
Okay, thank you.
Thank you.
Rep. Kobayashi.
What about the other complexes? I mean, number one, by my thinking, these are not all of the rural complexes. I mean, do you consider, Leeward rural or?
So currently, the Office of Student Support Services is the recipient of a USDOE grant, and these are the rural areas that are identified through that grant. So it's a proposal, and we would have to identify, we would need a little bit of time to identify all of the rural areas that would qualify for this. So right now, these are the subset of rural identified complex areas under that grant. So we use that as a basis.
So are the non-rural areas adequately covered?
I would say that depending on the complex area, we do have BHS coverage for all schools across the state. Of course, every complex area would benefit from more behavioral health specialists. And so we do have proposed budgets that we could provide for you for additional staff for all complex areas.
I'm translating that as to saying that the non-rural areas are not adequately covered.
Every state school is covered, but they could always benefit from additional mental health support.
Okay. If every state school is covered, then you don't need this for the rural areas.
So right now, current caseloads are about 20 to 30%, and I think Chair Bellotti recognizes that there's this intense need of mental health supports and services across the state. And so while every school has access to behavioral health specialists, they're seeing an overwhelming number of students. So an increase in personnel would just expand the ability for us to support additional students.
What does this provide to the complexes named?
So for the rural areas,
would
go ahead.
That would be, what would these dollars provide to the complexes that are named that are either less or more than what non-rural complexes would have?
I think for these areas, for example, like the Leeward Coast, the number of students and the number of need that currently exists is higher than other complex areas. So increasing the staff in those areas would allow for smaller caseloads and greater support. For rural areas like the Big Island, Kauai, the geographic location of that environment requires staff sometimes to travel, and so they're not dedicated staff per school. They might spend 2 days on a campus and then on the next 2 days be on another campus. This would enable a designated staff member per campus in those areas. It would enable that flexibility to allot an individual to the campus so they wouldn't be traveling.
So if this funding were approved and implemented, the rural schools would be better staffed than the non-rural schools.
We have a proposal, and I see, right, like if we're looking for equity, we do have a proposal for allocating staff, the same number of staff per elementary school and high schools. So we do have that proposal. The budget would be pretty exorbitant, though.
So
But we are
until
happy
that
to prepare that.
proposal is implemented, the non-rural schools will have less staff, less support.
The intention is for there to be equity, so we would look at the needs within the complex areas, and then we could propose a budget based on the number of students per complex area. We're happy to do it that way as well.
Can I ask a follow-up? So would these behavioral health specialists be integrated into the Hawaii Healthy Keiki teams that exist in the complexes?
The Hawaii Keiki, the nursing
Yes.
program. So it's a separate program. They support each other.
Okay, so I understand that they're separate, but I think that there should be close collaboration.
Yes, for sure.
Because I think this could address Representative Kobayashi's kinds of concerns, right? If Hawaii Healthy Keiki is working in all of the complexes as we've designed it to, and essentially what you're doing is adding another behavioral health specialist in each complex, Hawaii Keiki is meant to be flexible so that you can deploy resources as you need, reduce caseloads, and then therefore have better flexibility and coverage like you're saying. And what we want this to be is by funding this kind of rural effort, understanding that the challenges in rural communities are in some ways more intense because of the lack of the real lack of actual specialists out there. This is actually a strategic way to deploy resources. Is that a correct way to explain this?
Yes, thank you.
Okay. Okay? Great. Thank you.
Thank you.
Oh, any other questions? Okay, great. Thank you, members. Moving on. Next, we're taking up a bunch of resolutions, both House concurrent resolutions and resolutions that we'll be taking in tandem. So first up, we'll be taking up HCR 26 and HR 28, requesting that the Department of Health create a formal plan to implement certain recommendations with respect to oral health care for Native Hawaiians. First up, Department of Health.
Department stands on its testimony, providing comments and offering amendments.
Thank you. Comments. Next, Hawaii Dental Association.
Aloha, I'm Melissa Pavlicek. I'm here today on behalf of the Hawaii Dental Association. We support this measure. We did ask for an amendment to include an emphasis on patient safety and the highest standards of care. We feel it's just very important while addressing the needs of the rural the rural population that we not lose sight of our quality of care. Thank you.
Thanks. Next, we have an individual, Dr. Don Sand.
Aloha, Chair Al-Balati, Vice Chair Takanuchi, and distinguished members. I want to stand by my written testimony and in support of the intent of this resolution. I do want to thank Rep. Mizuno and Christina Fenn for taking the time to read the Papa'ololokahi study, the 2019 E Ola Mau Mau. And I do think, other than a safeguard for the bill, the actual bill, 617, I think that serves the purpose of highlighting the brilliant study and the brilliant recommendations, that if our state of Hawaii implements these recommendations, that it can help us get out of the oral health care crisis for our vulnerable and our underserved. Thank you so much for the chance to testify.
Thank you, Dr. San. We also have testimony from one individual, B.A. McClintock, providing comments. Any other testifiers in the room wishing to testify? Please come forward. If you could just state your name for the record.
Good morning, Chair Bellotti, Vice Chair Takenouchi, and committee members. My name is Sarah Kamakuviva-Ole. I'm the Director of Policy and Strategy at Papa'ololokahi. We're actually coming forward today to respectfully request the deferment of HCR 26 and HR 28. We have some technical corners that we have questions about, considering the inclusion of Native Hawaiians in oral health. That then does not include any particular Native Hawaiian organizations or other representation. We are very, very grateful for the number of legislators, including Representative Mizuno and others who have been part of introducing this, and for Chair and Vice Chair for scheduling this to be heard today. We see that as an extension of the commitment to Native Hawaiian health that the legislature has had for quite some time now, and we're really appreciative of also the community members in the room who support this. That said, Papa'ololokahi is actually currently in the next iteration of Eola in which our working groups are reviewing the past two iterations to make strategic plans about where to go next. So we're also respectfully requesting the deferral just in terms of linking things up in time. We really want to express our gratitude to Department of Health and all the other colleagues who support dental health, which, as many in the room know, is disproportionately affecting the well-being of Native Hawaiians. So again, we are super, super appreciative and just respectfully requesting the deferral just kind of based on timing and wanting to make strategic moves in the couple years to come. Thanks so much.
Thank you. Any other testifiers in the room? Any testifiers on Zoom? Seeing none. Members, any questions? Seeing none. Moving on to the next set of measures, HCR 32 and HR 33, requesting the Department of Health to convene an oral health task force to review information on the status of oral health in the state and make recommendations to improve oral health infrastructure in Hawaii. First up, Department of Health.
Department of Health stands on this testimony, providing comments and offering amendments.
Thank you. Department of Education.
Again, good morning, Chair, Vice Chair, and members of the committee. I'm Yvonne Humble. I'm from the Office of Student Services Support, testifying on behalf of the Department of Education. The department stands on its written testimony in support of this measure, and I'd like to thank you for the opportunity to testify today.
Thank you. Next, we have the Disability and Communication Access Board in support. Hawaii Oral Health Coalition with the Hawaii Public Health Institute, Patrick Donnelly on Zoom.
Hi, there we go. Hi, good morning, Chair Bellotti and Vice Chair Takenouchi, members of the committee. I'm Patrick Donnelly. I'm the program manager for the Hawaii Oral Health Coalition and Hawaii Public Health Institute. We absolutely support the intent of this measure and believe that this is critical to further assessing and addressing our oral health systems. But we do respectfully encourage that the development of an oral health task force continue to be considered through HB 617, which is still in progress and is currently referred to the Senate Ways and Means Committee for further consideration. I want to thank you all for adding this to the agenda and your time and consideration for this important issue. I'm available for any questions you might have. Thank you so much.
Thank you. Next, Hawaii Dental Association, Melissa Pavlicek.
Thank you. The Hawaii Dental Association supports this measure. We have been supporting the legislation as well and participating in the Hawaii Oral Health Task Force. We really value our community collaborations, and in an earlier hearing this session, we promised Rep. Bellotti that we would work together with her and the community. But whenever we see resolutions seeking to address the numbers of dentists with very few dentists specifically named to a task force, we just point that out or ask for the opportunity for more dentists to be named so that we can really be part and at the table for that conversation. Thank you very much.
Thank you. Next, we have Respiratory and Environmental Disabilities Association of Hawaii providing comments. Oh. Next, we have testimony from Don San. Thank you. And another individual, Nancy Partika, support with comments. Anybody else any other testifiers in the room wishing to provide comment on this measure? Any testifiers on Zoom? Okay. If not, members, any questions? Rep. Kobayashi?
For DOH, if the last year we funded adult dental Medicaid in the, I would say, middle level of funding. If we fund the adult Medicaid program to the highest level, how much of a dent would it make on this issue of, inadequate dental care?
Thank you, Representative Kobayashi. My name is Matthew Shim. I'm Chief of the Family Health Services Division, Hawaii State Department of Health. Unfortunately, I'd have to defer to the Department of Human Services MedQuest Division for impact of adult dental benefits from Medicaid.
I mean, my recollection was that the difference between what we funded at the middle level and the cost of the highest level was about $8 million in state funds, which would be matched by much more than $8 million of federal funds. So I would assume that it would make a sizable but not a really super big impact on those who currently don't have dental services.
I do know that adult Medicaid dental benefits, no matter at what level they are, since they have been restored, actually provide necessary oral care for folks, adults who are on Medicaid. Children who are served by CHIP already have dental benefits. So the addition of adult dental benefits actually helps the entire system. And so it's just one piece of oral health care in the state.
Thank you.
Any other questions? Seeing none, moving on to the next set of resolutions. HCR 34 and HR 35, requesting the Legislative Reference Bureau to conduct a study on the adequacy of elder care on Molokai and Lanai and in East Maui. First up, we have the Legislative Reference Bureau providing comments. We have testimony from the State Council on Developmental Disabilities in support. We have testimony support from some individuals, Courtney Page DiMaggio, Chelsea May Pupuhi, and Lois Inkler in support, all in support. Also, I think that's all the testimony we have on these measures. Any other testifiers in the room wishing to provide comment? Any testifiers on Zoom? Seeing none, members, any questions? Okay, seeing none, moving on to HCR 45 and HR 49, requesting the Governor's Coordinator on Homelessness to conduct a study on the cost of programs and services necessary to end chronic homelessness by 2030. We have testimony in support from two individuals, Corey Rosenlee and Cards Pinter. Anybody, any other testifiers in the room? Please come forward.
Aloha, Akayaka, Chair, Vice Chair, and the committee. Angela Melody Young testifying on behalf of CARES. So homelessness is a policy concern, a humanitarian concern, but it is also a medical and public safety concern. The medical and public safety part, the public safety is what people tend to overlook. And so the federal HUD defines chronically homeless as an unsheltered person with debilitating medical conditions or disabilities. This is a medical concern. It also involves public safety because HPD is dispatched to respond to homelessness. Although the root of homelessness is medical, when homeless people get rowdy, it becomes domestic violence, destruction of property, a public safety concern. So in this regard, CARES is proposing that perhaps the format of this resolution can be restructured to involve the city who is already involved in like medical and public safety initiatives, such as the city's Department of Community Services, who works with PIG, Partners in Care, Emergency Services Department, which operates CORE, Crisis Outreach Response Engagement, and the ambulance, and the Honolulu Police Department, which operates HONU. So these stakeholders from the city will have valuable information about the medical costs to addressing homelessness. And the city has been waiting eagerly for more direction and collaboration from the state for a formal request to work together. We can see that, so why do I say that they've been waiting eagerly? Because last week during the State of the City address, they mentioned that they are already preparing to look for city properties to provide for the villages. And also the city council was deliberating about CORE and then what will happen to the homeless people after CORE is dispatched. For these reasons, it would be better to include the city into this collaboration. And we can see that HCR, House Concurrent Resolution 89 and Senate Concurrent Resolution 88, House Concurrent Resolution 157 requested the counties to work together in addressing housing and to provide additional resources. And because of the resolutions, the city now responded with a similar resolution and is currently working on addressing these concerns. So, those are our comments.
Thank
Thank you for the opportunity to testify.
Thank you. Any other testifiers in the room? Please come forward.
Good morning, Chair, Vice Chair, and members of the committee. I'm Betty Lou Larson with Catholic Charities Hawaii. I apologize, we do not have written testimony. We've just seen this resolution, but I did want to comment on it. Our comment is that obviously this is something that's needed to look at these issues, to look at the wide range. However, we fear that maybe this is not the right timing. This is a new office, a new coordinator. As far as we know, there's only the director and one staff's been hired. So they're in the process of really looking at major initiatives that the governor has and that the service providers have. And long term, we agree that this is something that should be looked at. But we just fear that it would need additional staff, and they're already in the process of trying to hire staff for just the major priorities of the governor's coordinator's office itself. So we support the long-term nature of this, but we suggest that maybe this is not the right timing. Thank you. And we would be happy to provide written support, written comments.
Thank you. Any other testifiers in the room? Any testifiers on Zoom? Seeing none, members, any questions? Chair Bellotti?
Ms. Larson. Betty?
Sorry, a Catholic cleric question.
I agree in part that a study may not be most appropriate, but as I look at what the work of this committee has to do, I think it would be appropriate to have a report on the costs of the programs and services currently, and then what it looks like and what the projections are needed for going into 2030. And I think it's actually highly appropriate, as I was working out some of these dates and times, that this would like be the roadmap of a plan for Governor Green's two administrations. So it's actually not a bad idea.
No, we're not thinking it's a bad idea, just long-term, it's definitely something that is needed.
Okay. And I ask because I think one of the things that we've struggled with is, you know, all of the service providers always come and ask for money and more money, and we understand that that's needed. But at some point, it's about money, it's about policies, it's about a lot of moving parts. And so I actually think that there's a kernel here that's really kind of quite important, actually.
No, I think that
And-
we would agree with that, yes.
Okay, and then I don't, it's not quite clear how this study or maybe a report or a plan would be done, but is it your view that Partners in Care would have kind of the best insights into what all the costs and services are of various service providers?
I think we definitely have to coordinate with that. We don't have a list specifically, but again, we have the network that could provide that in coordination with the governor's coordinator.
Okay, thank you. Thank you, thank you. Thank you, Vice Chair.
Any other questions? Rep. Kobayashi?
Betty Lou,
Sorry.
the resolution talks about ending chronic homelessness by 2030. I think that's a noble goal. I mean, we should end poverty by 2030. We should, you know, end so many other things by 2030. I mean, I'm not sure that that's the right goal.
I agree it's going to be a tough task.
I mean,
And
maybe we should end pollution by 2030 or traffic congestion. I think there should be another goal. I'm not sure what it would be, but thank you.
or the first steps,
Yeah.
some benchmarks.
Right.
To end it may be very tough.
Thank you.
Lots of work ahead. Any other questions? Okay, moving on to the next set of resolutions. HCR 101 and HR 108, requesting the Department of Health to convene a working group to review and update the relevant chapters of the Hawaii Revised Statutes that relate to mental health and involuntary transport, examination, hospitalization, and treatment, including assisted community treatment. First up, Department of Health.
Department of Health, thank you, Chair, Vice Chair, Representatives. Department of Health stands on its testimony in support with a caveat related to the start date for convening the work group, and we're here for any questions that you may have.
Thank you. Next, we have testimony from the Legislative Reference Bureau providing comments. That's all the testimony we received on these measures. Are there any other testifiers in the room? Any testifiers on Zoom? Seeing none. Members, any questions? Seeing none, moving on to HCR 168 and HR 173, requesting the Department of Human Services to perform a study on the Homeless Programs Office to determine if it is allocating adequate funding for each region of Oahu for homeless services. First up, we have Department of Human Services.
DHS stands on our testimony document and comments. Thank you, Chair.
Thank you. Catholic Charities Hawaii.
This is the reason why I'm here. I'm Betty Lou Larson with Catholic Charities Hawaii. We support this resolution. We'd like to note, however, that the key word here, we believe, is adequate funding. And so to look at not just how do you spread the current funding to other regions that may be underserved, but you really need to look at what is needed in those regions, and what is the adequate funding to create the services that are needed in perhaps underserved or areas that have a much higher need level, even per population, than perhaps other areas. And so we think it's an appropriate time to ask DHS to look at this. Of course, it coordinates with the governor's coordinator on homelessness, but I think this is the good timing for the state to look at these programs and how, within their purview, the Homeless Programs Office can look at adequacy of funding and give some guidelines and some direction for the legislature to look at this big issue. Thank you.
Thank you. That's all the testimony we received for this measure. Are there any other testifiers in the room? Go ahead.
Aloha, Chair, Vice Chair, and the committee. Angela Melody Young testifying in strong support. Although I don't represent DHS in any way, but our CARES advocacy grassroots is very active at a lot of the state discussions and also at the city council discussions. So I'm just gonna provide some comments. So the Department of Human Services implements the General Assistance Program and the EBT program, and as well as the Homeless Programs Office. So to access the data points from DHS is very necessary to see what are all the benefits to be provided for homelessness. But we also just want to provide comments that because in one of the discussions at City Council, they did mention working with they mentioned a potential collaboration. They were wondering about a potential collaboration with DHS and how to access data from DHS. We're just providing comments that perhaps the state legislature can consider working with the city for this. Thank you for the opportunity to testify.
Thank you. Any other members from the public wanting to testify in the room? Anyone on Zoom? No. Members, any questions?
I have a question for Ms. Larson and then Mr. Morishige. First, Ms. Larson, I think this is a worthy study and I'm supportive. I'd like to ask, would the service providers also be amenable to also being part of a study to understand whether and how, to what extent the service providers are being able to be a partner and draw down on federal Medicaid?
I think so. I know that there's already a coalition looking at true costs. So what are the true costs, and including that would be,
Okay.
What else could be there?
That's one side, but I think, right, because this is a resolution that's looking at allocations, but so much of allocations is also what are the service providers doing, and there is this tension at times that we know that they're not drawing down the federal matching that we need. So I think that's something, so it's not just about the Homeless Programs Office, but it's about Medicaid as well.
And I think at an earlier hearing, we talked about the difficulties that providers have had, and I know they're partners in care, and you've also expressed interest in trying to work on that too.
Yes, I think that would be, this is actually a good vehicle for that. Thank you. Mr. Morishige, if this was placed into the Department of Human Services, do you think that the Homeless Programs Officer and the Medicaid Office would be able to be helpful in both of these areas, both to comment on the allocation of funding as well as what's happening in the drawdown?
Thank you, Chair, for the question. As noted in DHS's testimony, there are other executive branch entities, such as other departments, that also fund homeless services. So we note that the Hawaii Interagency Council on Homelessness actually is an entity that these other government agencies do have a seat on, as well as the two COCs. And they're already currently required to do an annual report to the legislature, the governor, and the mayors of the 4 counties.
I don't see your testimony, but I don't have.
It's on the HR.
Oh.
HR.
Does it break it out in the ways in which this resolution is asking for?
I think the information requested in the report is very broad. So I think specifically there's a requirement that the report include generally fiscal and demographic information to support policy development. So I think the department's feeling is knowing that DHS is not the only entity that funds homeless services. The interagency council may potentially be better suited to support that kind of convening because it's more broad representation from a broader group of stakeholders.
Okay, quick question then, as follow-up. And because you're familiar with the Interagency Council, can they do this further breakdown?
I think as Ms. Larson mentioned in her testimony, I think one of the challenges is that the council is chaired by the Governor's Coordinator on Homelessness. So I think they would need some time to be fully staffed up to be able to support that work.
Okay.
Thank you.
Any other questions? Okay, members, moving on to HCR 186 and HR 191, requesting the Department of Health's Office on Language Access to establish an American Sign Language interpreter workforce working group to increase the number of American Sign Language interpreters in the state. First up, we have the Disability and Communication Access Board, Kirby Shaw, in support. We have the Office of Language Access.
Good morning, Chair, Vice Chair, and member of the committee. Apirak Bamruan, Executive Director for the Office of Language Access. We stand on a written testimony offering comment and amendment on this resolution and be available for any question the committee may have. Thank you, Chair.
Thank you. We have Hawaii Disability Rights Center, Louis Arshek, in support. That's all the written testimony we've received. Are there any testifiers in the room wishing to comment? Please come forward.
Aloha, Chair, Vice Chair, and the committee. Angela Melody Young testifying in strong support on behalf of CARES. So American Sign Language is not a building block for a language. It is a language itself. It is a visual language. And there is a need for ASL professionals to assist the blind and disabled community. The U.S. Department of Justice defines a qualified interpreter as someone who is able to interpret effectively, accurately, and impartially, both receptively. For example, understanding what the person with the disability is saying, and expressively, having the skill needed to convey information back to that person, using any necessary specialized vocabulary. And disability professionals are experiencing a national shortage, especially in the post-secondary environment. And so it is something to legislate, and therefore we support this resolution. Thank you for the opportunity to testify.
Any other members of the public in the room or on Zoom? Seeing none, members, any questions? Seeing none, moving on to HCR 187 and HR 192, urging the Hawaii Emergency Management Agency to include in all live and recorded emergency alert system video broadcasts an on-screen interpreter disseminating the emergency information in American Sign Language at all times, including during graphic presentations. We have testimony in support from the Disability and Communication Access Board. That's all the written testimony we've received. Anyone in the room wishing to provide testimony? Anyone on Zoom? Nobody here to ask any questions. Oh, please go ahead.
Aloha, Angela Melody Young testifying on behalf of CARES in strong support. So the tasks that are being legislated are to provide training for interpreters, especially for emergencies. And so this is very necessary because in a time of emergency, disabled people are going to have to be provided with communication assistance to prepare for emergencies and to respond to the emergency. Thank you for the opportunity to testify.
Thank you. Members, any questions? Seeing none, moving on to the next set of resolutions, HCR 205 and HR 209, recognizing and supporting ongoing collaborative efforts by state agencies and private organizations to implement the Hep-Free 2030 statewide strategy to eliminate viral hepatitis types A, B, and C in Hawaii. First up, we have Department of Health in support. We have Hawaii Health and Harm Reduction Center in support. Hep-Free Hawaii, Heather Lusk on Zoom. In support. We have testimonies from Renzi Alec from Hep-Free Hawaii and also Micronesian Education for Liver Wellness Program in support. And we also have 7 individuals all in support of these 2 resolutions. Is there anybody else, if any of them are present? Anybody else in the room wishing to provide testimony? Anyone on Zoom? Seeing none, members, no one's available to ask questions, so we'll move on to the next set of resolutions. It's HCR 207 and HR 211, requesting the Department of Health to convene an early lung cancer screening working group to continue the efforts of the Early Lung Cancer Screening Task Force established pursuant to Act 162, Session Laws of Hawaii 2022. First up, we have Department of Health.
Good morning, Lola Irvin for the Department of Health for Dr. Kennedy Fink, and the Department of Health supports the resolution, House Concurrent Resolution 2008, that resolves to push back various deadlines that are found in Act 162 that was passed in 2022 by 1 year. So thank you very much.
Thank you. We have Hawaii Medical Association in support. Hawaii Public Health Institute in support. And we have testimony in support from 2 individuals, Cynthia Goto and Pedro Hara. Or Pedro Hara on Zoom.
Hi, Chair, Vice Chair, members of the committee, Pedro Haro with the American Lung Association. We stand in full support of this resolution, and we thank the staff of the chair for working so quickly to be able to put this together. We just ran out of time on the bill that this committee had heard earlier, so we are in full support of extending it, the task force for 1 more year. Thank you.
Thank you. Any other testifiers? That's all the written testimony we've received. Any other testifiers in the room or on Zoom? Members, any questions? I have a question for Department of Health. So, I know the bill that we had that stalled in finance. Is there a Senate companion to that?
No,
or is this
there
the resolution is the only measure
The
moving?
resolution is the only thing remaining.
Okay. And I know there was funding tied to it that we can't, support with the resolution. Is that
Yes.
just something you guys are coming back for next year?
No, we should be able to go ahead and appropriate the funds within
Oh,
the
right.
time for fiscal year 23.
Okay, great. So
Thank
this is
you.
just to extend the actual work of the working group?
Yes, it would give us time. And we did convene the first part of the task force, and we are collecting recommendations for the second part of the task force. We do envision that it will be a very large task force, and meeting quorum may mean about 20 or 25 people. So we'll continue with the work, but we should be able to meet the requirements.
Great, thank you.
Thank you.
Okay, any other questions? Seeing none, we will recess for decision-making. Recess. reconvening the Committee on Health and Homelessness to take up decision-making on our 10:40 a.m. agenda here in Conference Room 329. First up, we have decision-making on HB 1044 SD2 HD1. Recommendation is to pass out an HD2 on this to just specify that it's going to be licensed behavioral health specialists in the bill, to add the word licensed throughout the bill. Members, any questions, comments, or concerns? Seeing none, Chair, you could take the vote.
Chair's recommendation is to pass Senate Bill 1044 SD2 HD1 with amendments. Chair, Vice Chair votes aye. Representative Amato.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi.
Aye.
Representative Mizuno.
Aye.
Representative Nishimoto.
Aye.
Representative Garcia.
Aye.
Madam Chair, your recommendation is adopted.
Thank you. Moving on, we'll be doing decision-making on the resolutions on our agenda. First up, HCR 26 and HR 28. This was for the oral health care, a plan for oral health care for Native Hawaiians. After hearing from Papa'ololokahi on this measure, recommendation is to defer since they are working on a lot of these issues within their own communities. Next up, HCR 32 and HR 33. Recommendation is to move out with an HD1. We'll take the recommendation of DOH and the Hawaii Dental Association in this measure. Any questions, comments, or concerns, members? Seeing none, Chair for the vote.
Members, Chair's recommendation is to pass HCR 32 with an HD1. Seeing the presence of all members here, any opposition? Any reservations? Chair, your recommendation is adopted.
Thank you. Moving on to HCR 34 and HR 35. This is the study for adequacy of elder care on Molokai, Lanai, and East Maui. Per LRB's testimony, we will move the agency conducting the study to the Executive Office on Aging, who's likely better equipped to kind of pull together this information. And that's all. Any questions, comments, or concerns? Seeing none, for the vote.
Members, Chair's recommendation is to pass HCR 34 and HR 35 with amendments. Any reservations? Any no's? Seeing none, Chair, your recommendation is adopted. And just noting that for the previous one, it was HCR 32 and HR 33, which we voted. Thank you, Chair.
Okay. Moving on, HCR 45 and HR 49. A study for the programs, services necessary to end chronic homelessness by 2030. Recommendations to pass unamended.
Members, Chair's recommendation is to pass HCR 45 and HR 49 as is. Any reservations? Any no's? Seeing none, Chair, your recommendation is adopted.
Thank you. Moving on to HCR 101 and HR 108. Per LRB's testimony, we will have DOH lead creating the report. And if there's any bill recommendations, that will be taken up with LRB at a later time. We'll also take the recommendation to move the report due date back to 10/31/23. Any questions, comments, or concerns? Yes.
Maybe we should move the date even further back. I mean, oftentimes we have the date 20 days before opening of session. You know, which is kind of like semi-standard.
Sure. I think the intent was to give time to make legislation. The day was requested by Department of Health.
So.
Okay. 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 We'll move it to 20 days before the opening of the 2024 legislative session to give everyone more time to do the work and get everything ready for next session. Okay. Yeah. Any other questions, comments, or concerns? Chair for the vote.
Chair's recommendation is to vote, pass HCR 101 and HR 108 with amendments. Any reservations? Any no's? Seeing none, Chair, your recommendation passes.
Thank you, members. HCR 168 and HR 173 for the study of the funding for homelessness programs in different regions. I received instruction, or in collaboration with the introducer of the resolution, we're going to make an amendment on page 2, starting on line 18, that the Department of Human Services is requested to form a study to determine if government is allocating adequate funding for each region of Oahu for homeless services instead of just focusing on the homeless programs office. Request is to just look at government funding for all of these regions. We'll also make technical non-substantive amendments for clarity, consistency, and style per HMSO. Any questions, comments, or concerns? No? Chair for the vote.
Chair's recommendation is to vote to pass HCR 168 and HR 173 with amendments. Any reservations? Any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. Moving on to HCR 186 and HR 191. Per the testimony we received, we will take the recommendation to make the language access and that the Disability and Communication Access Board will be the entity in charge of the working group. We'll take the changes to make those updates in DOH's testimony. We will remove Senate President and House Speaker from entities that will receive the certified copies, since we already get those as we're working on them, and also technical and non-substantive amendments for HMSO. Any comments, questions, or concerns? Seeing none, Chair for the vote, please.
Chair's recommendation is to pass HCR 186 and HR 191 with amendments. Any reservations? Any opposition? Seeing none, Chair, your recommendation is adopted.
Thank you. Moving on to HCR 187 and HR 192. Recommendation is to pass unamended. Any questions, comments, or concerns? Seeing none, Chair for the vote.
Chair's recommendation is to pass HCR 187 and HR 192 unamended. Any reservations? Any noes? Seeing none, Chair, your recommendation is adopted.
Thank you. HCR 205 and HR 209, recommendations to pass unamended. Any questions, comments, or concerns? Seeing none, Chair for the vote.
Chair's recommendation is to pass HCR 205 and HR 209 unamended. Any reservations? Any opposition? Seeing none, Chair, your recommendation is adopted.
Thank you. Members, last set of resolutions, HCR 207 and HR 211, recommendations to pass unamended. Any questions, comments, or concerns? Chair for the vote.
Chair's recommendation is to pass HCR 207 and HR 211 unamended. Any reservations? Any opposition? Seeing none, Chair, your recommendation is adopted.
Thank you, members. We're adjourned.